Hey everyone. So today I'm going to give a high-level overview of post-traumatic stress disorder. So what is PTSD? It really is a culmination of psychological symptoms following exposure to one or more traumatic events that often accompany violence, wars, and natural disasters. We do see a higher likelihood of people developing PTSD if the traumatic event involves danger or violence from other people. So, wartime experiences, rape, assault. We also see a little bit of a gender variation where men are exposed to traumatic events more often than women, but women are more likely to develop PTSD. Common psychological symptoms include sleep issues, irritability, difficulty concentrating, hypersensitivity to noises or movements, and flashback episodes in which people think that they are reliving that traumatic event or series of traumatic events all over again when they really aren't. So all of these things really contribute to distress socially, to feelings of detachment. We even see paranoia and hallucination in PTSD. So it really is a serious mental disorder. So I want to focus on the amygdala and the hippocampus. Here is a view of the limbic system. And this is really going to be involved in a couple of things, emotional responses and memory. So we see memory in the hippocampus, and then we see emotional responses happening in the amygdala. And we're going to focus on those two. This schematic is an image of a really high level overview of a fear response. Again, we didn't really go over it in class. But what happens in a fear response is that there is a fearful stimulus that is presented, so either visually or an auditory stimulus that then goes to the thalamus, so the relay station of the brain. That sensory information will go there, and then it will then go to the cortex to be processed further. From the cortex, that sensory information will travel to the hippocampus. And so this is where the hippocampus plays a significant role. Aside from memory, part of what the hippocampus does is to recognize the context of events, and then it aids in distinguishing between what is safe and what is dangerous by inhibiting amygdala activity. So it does contextual learning. It participates in contextual learning. An example of this is, let's say you're walking down the street and you hear an aggressive dog bark. At first, you might get startled, you might start to walk a little faster, but then you turn and look and you see, oh, the dog is in a kennel. And so then the hippocampus would be responsible for inhibiting the amygdala and saying, hey, we're okay. The dog's in the kennel. It's a cool situation. You're safe. Well, people with PTSD, we see that this system is inhibited and they don't get the hippocampus that really distinguishes between what is safe and what is not. The part of the amygdala that's really involved is the basolateral nucleus. Other brain regions involved include the medial prefrontal cortex. So it's going to be this region right in here. And it also plays a role in inhibiting emotional responses in the amygdala. So there's a functional imaging study done where people with PTSD were shown pictures of fearful expressions or traumatic event reminders. And we see a couple things from that. And yellow is excitatory. So we see that there is hyperactivity in the medial anterior cingulate, which is part of the limbic system. And then we also see, of course, hyperactivity in the amygdala. Conversely, though, we see hypoactivity in the ventromedial prefrontal cortex and in the inferior frontal gyrus. So all parts of the prefrontal cortex, we see some lower activity in being able to regulate emotional responses. So common treatments include CBT, group therapy and antidepressants to treat some of that depression, anxiety, and sleep disturbances that happen. Psychotherapy has shown to reduce amygdala activity and increase some activity in the prefrontal cortex and hippocampus. So it increases some of those regulatory areas. What I find most interesting, though, is MDMA assisted psychotherapy has really come to the forefront for PTSD treatment as a way to provide an alternative to some of these other things, specifically SSRIs and SNRIs. MDMA is commonly known as Molly or ecstasy, but it really is an entactogen that promotes empathy and compassion for oneself and for others. And it does that by elevating oxytocin. So, oxytocin is a neurohormone that is involved in pair bonding. It also stimulates serotonin and norepinephrine. So, it has some of those antidepressive, anti anxiety properties. And then it also elevates dopamine. In addition, it reduces activity in the amygdala and increases activity in the prefrontal cortex. So it increases some of that regulation and then kind of tempers that emotional response a little bit. This schematic just shows where in the process that MDMA helps. And really, what's important with this particular treatment is that it opens patients' minds up to talking about deep emotional experiences. And so with that, we see longevity in that treatment. We actually see that it's a little safer. There's fewer side effects compared to antidepressants. And there's a higher rate of retention. People continue to participate in it more. And so I also want to note that the MDMA is in very small doses and it is administered by trained medical professionals, so psychiatrists. But I think it has a lot of potential to really be beneficial in the treatment of PTSD and also keep safety and side effects in mind. So this is just my very long list of references, but I hope that y'all enjoyed this presentation on PTSD. There's a lot of research that needs to be done still around it, and I encourage you to dig further into PTSD if you get the chance.